Medicare. It's insurance basically for medically necessary services. Medicare covers a lot of things. There is not a great deal of trouble with things that doctors prescribe as treatments for things being covered by Medicare. Medicare is very liberal in their coverage of approved procedures. But there are lots of things that Medicare doesn't cover at all. And what I want to do before we talk about what they do cover is cover some of the broad things that Medicare doesn't cover at all in original Medicare. First of all, prescription medications are not covered by Medicare A and B. You do have the option to buy a Medicare Part D prescription drug plan from a private company, but original Medicare includes no prescription drug coverage for drugs that you would pick up at the pharmacy on a regular basis. Medicare does not cover routine dental care at all. Medicare will cover dental if you have diseases of the gums where it's actually a disease, or if you're in an accident and you have damage where it's out of your control. But routine dental care, no coverage at all. Vision care, Medicare covers things related to disease, glaucoma, cataracts. They'll pay for the services of the physician and the glasses that go with them. However, routine vision care and glasses not paid for, although they do pay for the initial screening test at an eye doctor, because that screening test is looking for disease. So they do pay for that, but if you then need, through normal aging and changing in your eyes, to be fitted for glasses, they don't pay for the fitting and they don't pay for the glasses themselves. Medicare doesn't pay for hearing at all. Medicare doesn't pay for foreign, when you're out of the country. Medicare does not follow you. It's in the states and the what do you call the territories? In the territories that you have coverage. And there are some minor rules about if you're on a cruise ship within so many miles of a U.S. port and so forth. But for the most part, just figure when you're out of the country and you're on Medicare, you probably should be looking at travel insurance or be concerned. Many supplement plans have foreign emergency travel coverage. That's one of the things to be aware of, is in one of the advantages to buying a supplement plan. Medicare does not pay for cosmetic procedures. It has to be medically necessary. They're not going to get any of us hair, guys. So that they are not involved in anything cosmetic in nature. Medicare does not pay for long-term care. Medicare pays for skilled nursing care when it involves therapies that will return you to health. If you are in a situation where the treatments in a skilled nursing facility no longer are returning you to health and it's becoming a custodial situation, Medicare is out of the picture, and you are basically dealing with a long-term care situation. And long-term care is paid out of personal resources, individually pre-purchased long-term care insurance, or Medicaid. And actually 80% of the folks in North Carolina in nursing homes are being paid by Medicaid. There is another huge part of the federal budget dilemma, or actually a state budget dilemma, because Medicaid is a multi-agency responsibility. So as you look at Medicare not being completely funded and Medicaid being a 100% unfunded situation, you can see the challenges of balancing a budget, whether it's federal or state. Let's look at the benefits of Medicare A and B. Again, A, and again, this is all in the combo form in a very simple chart. Medicare actually mails to folks a 130-some page brochure called Medicare and You. It's a booklet. The brochure is a little big for 138. A booklet of Medicare and You 2000 and whatever that goes into these benefits in detail. Most people will understand it much better from this simple 2-page table format. So I suggest whenever you're counseling somebody to use this table format. And we also mail this out from the SHIIP office to anybody that wants one. Medicare Part A, called hospitalization insurance, it pays for inpatient hospitalization services with a deductible. The deductible, if you go into the hospital on Medicare Part A, you are responsible for $1,100. And that will cover the first 60 days, whether you're there for 1 day or for 20 days or 50 days. $1,100 covers it. Medicare pays the balance. If you happen to be in the hospital more than 60 days, at day 61 and for the next 30 days, Medicare will require a payment of $275 a day, and you pay the balance. If your stay happens to exceed that 90-day period, there then is 60 more lifetime days that Medicare will provide. You can only use these 60 days once, and you are responsible for $550 a day. These are really not relevant situations anymore in the medical world. People do not stay in the hospital that long. And it actually is not based on an annual situation. I'm going to talk about it in a moment after I deal with skilled nursing. These benefits are based on a benefit period, which I will discuss in just a moment. But I want to get to skilled nursing, which is the second thing that Medicare pays for under Part B, because it falls under the benefit period definition. Medicare under Part A also pays for skilled nursing care in a facility when it follows a 3-day hospitalization. If there's less than 3 days in the hospital, they don't pay at all. Hospitals know this. They're not going to discharge somebody on day 2 into a skilled nursing situation. They will think this through and keep them for 3 days. What is the co-payments for skilled nursing? Medicare pays 100% of the first 20 days in a skilled nursing facility that is ordered by a doctor. You don't choose to go to a skilled nursing facility. A physician prescribes that is where you need to receive your services. Days 21 through 100, the next 80 days, you are responsible for $137.50 a day for the next 80 days. If you go past 100 days, there is no coverage with Medicare within the benefit period. Now let's go back to this thing about the benefit period. This $1,100 for the hospital visit and the days we're counting and everything else are determined. They're not an annual situation, and they're not a per event situation. They're based on a benefit period. A benefit period under Part A begins the day you're admitted to the hospital, and it ends 60 days after your discharge from the last facility. So if you're in a hospital for 7 days and then you're discharged into a skilled nursing facility and you spend 2 weeks there, 14 days, when you come out, if you go back in within 60 days, you're in the same benefit period. The positive to that is if you go back in the hospital, and it doesn't have to be the same hospital, and it doesn't have to be the same disease or cause. It can be completely unrelated. It's just, all we're doing is counting days. If you go back into the hospital, you do not have to pay that $1,100 again if you went back in within 60 days of discharge. That's the positive. The negative, or something that causes problems, is when you go back in within a benefit period, they count days where you left off. So you spent 7 days originally in the hospital, you go back in day 8. You still got 52 days of coverage again. That never comes up. Where you hear problems with this is the skilled nursing benefit. That example I just used, spent 14 days in the skilled nursing facility. They come back out, go in the hospital within that 60-day period, don't have to pay $1,100. They need skilled nursing care when they come out. They're going back in on day 15, and they've only got 6 days of 100% paid skilled nursing facility. This is where you get complaints. This is where the benefit period comes up. People go into skilled nursing. Medicare is supposed to pay 20 days. Well, they've already paid 14 within that benefit period. So it cuts you out of what appears to be a legitimate benefit. It's just the way they count the days. Now, if you stay out more than 60 days, everything resets. So you get more days, but you also get the payment responsibilities of the $1,100 for the hospital deductible. So Gina's got a question.
I think this would be odd that it would ever happen, but say somebody goes into the hospital. They're there for a week. They get discharged. They are rehabbing, and I know this from personal experience. If you are not improving, they are crunching down on these skilled nursing facilities that aren't showing an action plan that shows you getting better, and they will cut you off on a flat second from
Right.
Medicare payment. But say the person is rehabbing and they are improving, and say they were in the hospital for a week and they're in the skilled nursing, and literally they go through the 60 days. So they've gone past the benefit period in the skilled nursing, continuing to rehab. They've
Right.
gone past the free days. They're
Right.
now into where they're paying, $137.50. Could you all of a sudden have $1,100 premium again?
No, because you wouldn't be, well,
You're
no,
back-
because,
you're-
because the benefit period is based on 60 days after discharge from the last facility. So the benefit period, the 60 days doesn't even start till you're discharged
So
from the skilled nursing
I
facility.
thought it was from the hospital.
No,
Thank
it's,
you.
it's from the last facility.
Okay, great. Thank you.
So that's one interesting thing about these numbers I just threw out. They're all related to that $1,100. The 30 days that are $275, that's a quarter of $1,100. The 60-day lifetime days that are $550, that's half of the $1,100. And the skilled nursing facility copayment is 1/8. The $137.50 is 1/8 of the $1,100. So each year they adjust the $1,100. It goes up every year. Last year it was $1,068. This year it's $1,100. Next year it'll be some higher number, I would assume. And all those other numbers will go up accordingly with the quarter, half, eighth. Okay, Medicare Part A, we've got hospital, we've got skilled nursing. Also paid under Part A is home health care. If you go into a home health care agency, either straight from the hospital or after your skilled nursing care, Medicare pays 100% of home health care services. The services of people to actually come, home health care agency, to send people to your home to provide these doctor-ordered services, Medicare covers at 100%. If you need durable medical equipment, you need a hospital bed, you need a breathing apparatus, you need a walker, Medicare pays 80% of the cost of that equipment. You are responsible for 20%. Also paid under Part A is hospice. If you go into the hospice program, if you choose to give up care for one specific illness that has been diagnosed as something that will result in your imminent death, then Medicare will pay 100% of hospice services under Part A, with some minor exceptions that they pay 95% for. There are a few pain-related drugs that currently they only pay 95% of the cost of, but hospice is pretty well covered at 100% through Part A. They're also, under Part A, is a blood deductible. The first 3 pints of blood that you receive in the hospital, you are responsible for, with Medicare paying the balance after 3. That's Part A benefits. The one thing to remember about that hospital Part A benefit is it's only what the hospital bills you. It's the room and board, the nursing services, the use of recovery rooms, intensive care units, medications that might have been administered while you're in the hospital. It's what appears on the medical bill. Every physician that treated you while in the hospital will bill under Part B. And that's where your major exposure is in Medicare, is Part B. Part B of Medicare is called medical insurance. It covers mostly, the most common is physician's charges. Also covers outpatient events. If you have surgeries on an outpatient basis, they are paid under Part B. It covers home health care, just like under Part A, if there's no hospitalization in advance of the home health care needs, because there certainly can be home health care needs after an outpatient surgery. It covers lab work under Part B. So these are your Part B services. For Part B services, physician's charges, Medicare has an annual $155 deductible. The first $155 of Part B services, wherever they come from, the individual is responsible for 100% of those charges. After you've met that deductible, Medicare pays 80% of most things, and you are responsible for 20%. And that's an unlimited 20%. In pre-Medicare insurance, almost any plan has a maximum annual out-of-pocket risk. No such concept in Medicare. Whatever amount of percentages are your responsibility, those dollars are your responsibility, unless you have secondary insurance, which we'll talk about a little bit if we have time. One exception to this 80-20 rule is mental health services. Medicare pays for mental health services, Medicare pays 55%. The individual is responsible for 45%. This is a change. Last year it was 50-50. Next year, the assumption is that this will continue to change at some basis, probably 5% a year, until mental health services are covered 80-20 like physical health services are covered currently. So mental health services are the one exception to the 80-20 rule. Lab work covered under Part B. Medicare pays 100% of lab work that involves analysis of blood and urine or biopsies. If you have an MRI or something, that's a procedure paid at 80-20. But lab work done with blood, urine, or a biopsy, 100% coverage. Home health care under the Part B side is paid at the same as under the Part A side, 100% for services, 80-20 on equipment. One minor thing, but if you ever run into it, you'll know you've heard it before. If you start out in Part A home health care services, after 100 days, if you're still on home health care, they'll switch your home health care over to B. Same coverage, but it's just a technicality, the way the rule's written. That A won't pay for more than 100 days of home health care services before they would switch over to B. Also paid under Part B, outpatient events. If you go have outpatient surgeries or outpatient MRIs and those type of things, again, they're subject to the $155 annual deductible. Then after that, 80-20. And then you've got also on the Part B side, the blood deductible. Blood is goes toward, if it's the first thing, $155 deductible, and then it's 80-20. So that's your basic Medicare Part A and B services. Again, there's substantial risk that you can incur a lot of out-of-pocket expenses, especially on the Part B side, because 20% of every physician that may see you while you're in the hospital, their bills can add up to many thousands of dollars, and your percentage can be thousands of dollars. So the Part B side is where the risk really lies with Medicare.